Our top story, a Valley child just a little more than a year old died of an accidental drug overdose. Good evening, everyone. I'm Todd Quinones.
And I'm Trisha Keene. The Clark County Coroner's Office says the little girl died of a lethal dose of heroin and fentanyl. No arrests have been made, but police have been investigating since the child died back in April.
In 13 Action News anchor Carla Wade now joins us live with a look at why more children are falling victim to drug overdoses.
Todd and Trisha, while a child dying so young of a drug overdose is definitely tragic, unfortunately, it's not as rare as you might think, and it's been increasing along with our opioid crisis. It was back on April 13th that police and paramedics responded to a call about an unresponsive child inside a home near Boulder Highway and Russell. Now, the Clark County coroner has determined that child died from an accidental drug overdose of heroin and fentanyl.
People don't realize a small pill, fentanyl by prescription, can be literally lethal for a child 1, 2, 3, 4.
Dr. Constantine George says we have an epidemic of drug use, both illegal drugs and prescribed medications.
So if you have the adult population that has more accessibility, they're going to have more of these things in their home environment where the kids are, and so they have more access to those substances.
While we don't know how this child got either drug, overdoses among children and teens are on the rise. The Centers for Disease Control and Prevention has been tracking the numbers for 2 decades now. When it comes to opioids, the number of deaths from overdose has tripled. Shockingly, 25% of the deaths involving children under 5 were intentional. Documents from the Division of Family Services show that this child's family has a history with Child Protective Services, including an incident from 2016 before the child was born. The allegations were substantiated, but the case was eventually closed. The report saying the family was not in need of referrals or services. Denise Tanata can't speak for CPS, but does offer a possible explanation.
A lot of times that would mean that the court came in, and even though the child welfare agency substantiated a case, a court didn't feel there was sufficient evidence to move forward.
What she can speak to is the need for more resources for drug-addicted parents that emphasize treatment over punishment.
Parents need to not be afraid that if they have an issue, that if they come forward or try to seek help, that they're automatically going to have their children removed.
Carla Wade, 13 Action News.